on to Chapter 9 in ICD-10-CM. This is diseases of the circulatory system, I00 through I99. And this chapter classifies diseases of the heart and circulatory system, which includes veins and arteries. Now, your heart works as a pump that circulates blood to the organs, right? So it circulates blood to the organs, tissues, and cell bodies throughout your body, right? And common diagnoses in this chapter includes hypertension, arteriosclerotic heart disease or coronary artery disease or CAD, myocardial infarction, and cerebrovascular disease. Now, these are some of the most common ones, and these are some of the most common that have guidelines associated with it. Hypertension. Hypertension is a common diagnosis that we're going to code for. So what is it? Well, hypertension, aka blood pressure, is a sign that the heart and blood vessels are being overworked. And if left untreated, the disease can lead to other diseases such as atherosclerotic heart disease or CAD and congestive heart failure, just to name a few. And the heart, when it has to work harder to pump blood, and when the blood pressure is high, it can lead to the thickening of the heart muscle and reduce the efficiency of the heart. And over time, this can progress to heart failure. It can progress to coronary artery disease and other cardiovascular issues. And hypertension is also often considered an indicator or risk factor of heart diseases and or heart failure. So that brings me to the very first guideline that we will learn. And guideline C9A, hypertension also includes high blood pressure. So if the doctor says the patient has high blood pressure, it's the same meaning, and the code for hypertension is I10. The next guideline, Chapter 9, A1. When you have hypertension and heart disease in the same setting, just like Miss Eva was talking about, other certain specific diagnoses in addition to hypertension, that patient has hypertension, heart disease automatically. It's a causal relationship. The doctor does not have to link both diagnoses. The doctor doesn't say, well, the patient has heart disease due to hypertension, therefore they have hypertensive heart disease. No, if documented in the same setting, hypertension with certain specific heart diseases, and you'll see them, they're in parentheses, so you'll know, the patient has hypertensive heart disease. And if they have heart failure, you're going to sequence first I11, the hypertensive heart disease, and second, heart failure. You're going to have to specify the heart failure. I'm going to go back. I felt like I left the page too soon. And just like hypertension and heart disease, when a patient has hypertension and kidney disease, guideline C9A2, the doctor does not have to establish a causal relationship. The doctor doesn't have to say that because the patient has hypertension and chronic kidney disease, they have hypertensive CKD. No, as a coder, you can code it as hypertensive CKD as long as both are present in the encounter, and as long as the doctor says it's not related. Now, if the doctor says they're not related, then you have to do something else. All right? So if the doctor says they're not related, then you can just go ahead and code each separately. But this is the way you sequence. I-12 for hypertensive CKD, and then the second code will be your CKD N18, and your fifth character or your fifth digit will indicate the stage, the CKD stage. So make sure you read the guidelines and instructional notes. All right? How are you doing, coders? Is that sticking? Miss Eva kind of said it, and now we're saying it again. Let me know. Type in the chat. Good job. So someone said, hey, I'm doing great, doing good. Got it. Good. All right. Now, guideline C9A3. All right. So this is when the patient has all three. They have hypertension, they have heart disease, and CKD. All three. If they have all three, the doctor does not have to say they are due to or related. As the coder, you can go ahead and code it as hypertensive, heart, and CKD, I13. And then next, you're going to sequence your heart failure. And third, you're going to sequence the CKD. Make sure you read the guidelines and instructional notes. They will help you sequence. Indeed. Either you're going to know it, and if you don't learn these things, then you'll have guidance through your instructional notes. And I'm going to show you throughout. The exercises. Now, guideline C9A4. This is hypertensive cerebrovascular disease. So this patient has hypertension and cerebrovascular disease, like CVA, cerebrovascular accidents, aka stroke, etc. Now, the causal relationship is not presumed. So the doctor has to say that the hypertension and the cerebrovascular disease is related. So if that documentation doesn't say it, you do not, say it's hypertensive cerebrovascular disease. And if the documentation does specify it, you're going to sequence it as following. I60 through I69, and your second code will be your hypertension code. Now, let's switch gears from hypertension and let's talk about CAD, coronary artery disease, aka arteriosclerosis, and arteriosclerosis with angina pectoris. Guideline C9B, Chapter 9B, atherosclerotic coronary artery disease, ASHD, and angina. Anytime the patient has angina, that's a type of pain associated with CAD, you need to use a combination code, right? The combination code will have the CAD along with angina or without angina. In the sequencing order, you're going to sequence first I25.11 or I25.7 if the patient had a coronary artery bypass graft. So if that is the case, whatever the case, use the appropriate code and do not code angina separately. All right. Now, let's do a code lookup walkthrough. We're going to do this together. You have a lot of opportunity today to look up things on your own. So let's do it. All right. So this involves hypertension. So let's put on our hypertension hat or brain. Yeah, the brain. And if you want a code for hypertensive nephropathy or nephropathy, first, there are some diseases that you can code that are presumed causal, and this is one. Because when you think of, if you break apart that term, nephro means kidney, nephropathy, that's kidney. So that's hypertensive, and there's some kidney disease going on. So it's possible that this could be hypertensive CKD. Now, the first thing I'm going to do, I'm going to look up hypertension or hypertensive in the alphabetic index. Hypertension. Then I'm going to scroll down to kidney because nephro means kidney, right? So this is hypertension with kidney. All right. And that's it. And then it tells me that I need to determine if it's stage 1 through stage 4 chronic kidney disease. Okay. And then I have to verify in the tabular list, and I'm going to read all notes. So here's my tabular list. It took me to I-12.9. They say that's my code. I'm going to stop at the boss. Hypertensive chronic kidney disease. And it includes any condition in N18 and N26 due to hypertension. Okay, any condition. It includes arteriosclerosis of the kidney, arteriosclerotic nephritis, chronic interstitial, and it also includes hypertensive nephropathy. So this is coded under this category. So we don't know the stage, do we? No, we don't know the stage. So I'm going to use I-12.9 hypertensive chronic kidney disease with stage 1 through 4 chronic kidney disease or unspecified chronic kidney disease. And this CKD was not specified. So I'm going to use this I-12.9 as my code. And then underneath, I'm reading this instructional note. It says use an additional code to identify the stage of chronic kidney disease. Well, we don't know the stage, right? No. So let's look for the non or unspecified stage, N18 chronic kidney disease, N18.9 chronic kidney disease unspecified. I like that. The CKD wasn't specified. So if you looked at the guideline for hypertensive CKD, guideline C9A2, you would sequence first your I-12 code, followed by your N18. And specifically, we sequence I-12.9 because the CKD was not specified. Also, the CKD, excuse me, the hypertensive CKD was not specified. So we use I-12.9 and the stage was not specified. So we used N18.9. And that's our answer. Okay, coders, did you like that walkthrough? Was it helpful? Good, good. All right. So I want to give you a little way to know or distinguish the hypertensions. All right. Oh no, do I want to do that now or do I have another? I got another scenario, so I apologize for that. And then I'm going to give you my little tip. All right. So malignant hypertension with CKD stage 3. All right. So how are we going to look this up? First, we're going to look up hypertension in the index, then we're going to see malignant, then we're going to scroll down to kidney, then we're going to verify in the tabular list, and we're going to read all notes. All right? So here we go. Hypertension with kidney involvement. Look, or you can look here. It says with kidney involvement. Then it tells you to see hypertension kidney. Okay, hypertension kidney, right? And it says with heart disease I-12.0, and then with kidney disease stages 1 through 4 I-12.9. All right, so I like I-12.9. We have the same thing. So in the tabular list, we're going to verify I-12.9 down here. All right, and this is correct because this is hypertensive CKD with stage 1 through stage 4 CKD. We have stage 3, so we can use I-12.9. Now we need to verify our stage N18.3, right? N18.3. You know what? This is wrong. We always say we want to fix this. Oh, no, this is right. This is right. Sorry about that. All right, so stage 3 has stage 3A, stage 3B, and then unspecified stage. All right, so, and that's newer, the unspecified stage. So if we grab the guideline, it tells us to sequence first our I-12 code, then our N18, and the answer is I-12.9 and N18.30 because the stage 3 was not specified to be A or B. And I kind of went through that a little faster because we just did that one, but I wanted to just kind of reinforce how are you? Excellent. Excellent, excellent, excellent. You got it right. Outstanding. People are coding it, and this is a walkthrough. All right, so let me give you a little tip. When coding hypertensions, knowing the codes at a glance will give you a tremendous advantage, right? So it all boils down to this last character of the boss of the category. That's what's different between the codes. So what do these mean? Well, if it's I-10, this 0 means that there are 0 specified diseases with this hypertension. So there's no additional causal diseases, right? So this is your pretty much your hypertension code, the independent hypertension code. It's your standard hypertension code. There are no specified diseases. However, I-11, that one means that this is a heart. And when you think about it, you only have one heart, right? Yeah. I-12 got 2 signifies that you have 2 kidneys, right? And I-13, that 3 means that you have all 3 conditions. You have hypertension, you have heart failure, and you have kidney disease. Now, all of these codes are hypertension. So the first is just hypertension. The second is hypertension with heart disease. The I-1, or excuse me, I-11 is hypertension with heart disease and you have one heart. I-12 is hypertension with kidney disease and you have 2 kidneys or hypertensive kidney disease. I-13 is hypertension with heart disease and kidney disease. You have all 3 conditions and you have hypertensive kidney disease. Now, I got to tell you that a former student, a former instructor came up with this whole format. I came up with the I3. And she said, hey, well, why don't we do these? So we got to give her credit. Okay. All right. Outstanding. So it does resonate with one person. They said, wow, outstanding. So you're going to see that this will be an advantage when you take your exam, knowing these codes on site and being able to distinguish them on site will give you an advantage when you take the exam. I promise. All right. So now it's your turn to do what you do, and we're going to test our knowledge of the guidelines. But first, let's review how to solve an ICD-10-CM scenario. First things first, you're going to highlight or inventory your keywords. Your keywords are diagnoses, signs, and or symptoms. Number two, you should select the first listed or principal diagnosis code. Always just know what goes first. If you can do that, that's gold. And finally, apply all guidelines. All right. So inventory, select your first, and apply your guidelines. And with that said, I'm going to call Miss Stephanie to the floor. Please, Miss Stephanie, and thank you.
I thank you, Miss J. Coders, of the following answers, which best describes the encounter? A, I-10, Z96.6, B, Z96.6, RO3.0, C, I-10, and D, RO3.0, and Z96.6. Jeanette arrives at her ortho appointment to find out if she will need to have another procedure to remove her Cartiva implant. Upon arrival, Jeanette's BP was 150/70 millimeters Hg. The physician examined the patient and determined that the implant had not dislodged and no treatment was needed at this time. He also diagnosed the patient with transient hypertension and told to follow up with her PCP for further evaluation. Coders, you have 2.5 minutes to solve your problem, and it begins now.
Outstanding job. We got a lot of participation in that chat, and I love it. I just love it. All right, first things first. Let's go ahead and highlight our key terms. Remove her Cartiva implant had not dislodged, and transient HTN, transient hypertension. All right, so the patient came to this encounter to determine if her implant should be removed. So she went to the orthopedic doctor to see if her implant should be removed. Then the doctor determined that the implant is stabled. However, during that visit, the doctor determined that the patient's blood pressure was high. You know, when you go to the doctors, as a standard, almost standard, most doctors take your blood pressure. Now, some don't, but a lot do. This doctor did take her blood pressure and determine it was high and said, oh, that's just transient. She doesn't have a history of hypertension. That's just transient hypertension. Sometimes when we go to the doctor, we're nervous. And when we're nervous, our blood pressure rises, and that's called transient hypertension or white coat syndrome. Just FYI. All right. So there is a guideline, C9A7. When a patient has transient hypertension, you're going to code R03.0, right? So if they just have elevated blood pressure or they have white coat syndrome, do not code it as hypertension because that is a temporary high blood pressure, and hypertension is a diagnosis that has been established after some testing. This patient was not tested, all right? So just thought I would tell you. So because we're not going to code it as hypertension, we're going to get rid of A and C. And that leaves B and D. Now, we need to know how we're going to sequence this. What is the chief reason for the encounter? Why did that patient go in that office? And what was chiefly treated? Well, what was chiefly treated was that encounter to remove the Cartiva implant, right? He examined the patient and determined the implant had not been dislodged. So the doctor had some degree of specialty that he had to apply to making the determination that this patient didn't need surgery. So the chief reason for the encounter for that ortho visit was to check on that Cartiva implant. So we're going to use that encounter code. And the answer is B. There's no need to look it up. We know R03.0 is transient hypertension. So Z96.6 must be our encounter code. That's probably Miss Eva back there checking, fixing my slides. Thank you, Miss Eva, if that's you. All right, coders. What do you think? Did you learn something? I think a lot of people weren't sure about this. Outstanding. And even look at how it's written in the third column. It's in sequence first, R03.0, but maybe we need to change that to sequence the RFE first. So if you want to make that adjustment, you can, but I'm going to make the adjustment. And if you have the ebook, your adjustment will automatically be made because we'll be uploading it soon. So I like the ebook. All right, good job. Let's continue. All right, Ms. Stephanie, you did an amazing job. Please and thank you.
Thank you. Which answer best describes the encounter? A, I-10, E11.9, K21.9, and I50.9. B, I50.9, I11.0, E11.9, and K21.9. C, I11.0, I50.9, K21.9, E11.9, and ID, I10, and I50.9. Thomas arrives at his PCP's office with complaints of chest pain and edema. The physician did a full body workup and diagnosed Thomas with HTN, GERD, diabetic mellitus, and congestive heart failure. Which answer best describes the encounter? Coders, you have 2.5 minutes and your time begins now. I wish you well.
Outstanding job, coders. Outstanding. You did your best. Okay, coders, look, some of you got this right off the bat, right off the bat. But I'm going to tell you how you can too if you didn't. All right, so let's go ahead and highlight our key terms. We have chest pain, edema, that's swelling of the lower extremity or other places, hypertension, geoesophageal reflux disease or disorder, diabetes mellitus, and congestive heart failure. All right, so I went a little ahead, but I eliminated the chest pain because it's related to hypertension and congestive heart failure. I also got rid of edema because it's related to the same diagnoses. And that leaves us with HTN, GERD, diabetes mellitus, and CHF. CHF, congestive heart failure, and hypertension. Anytime you have hypertension and heart failure, what should be your code? Type in the chat. Type in the chat. Anytime you have hypertension and heart failure, what should be your code? How many hearts do you have? Yep. Yep. Yes. On site, we know that it should be I-11. I-11, you have one heart, right? That remember that last character? Okay. So on site, we already know the answer is C. See how important it is to learn those? Yes, when you're taking this multiple choice exam, indeed. So just so you know, this is where we get the guideline from C9A1 when a patient has hypertension with heart disease. Anytime you're going to sequence first I-11 followed by I-50, the specific heart failure. And these are all of the conditions. You know, when I say hypertension with heart disease, they have to have a heart condition that falls under these categories: I-50, I-51, you know, etc. And we do fall under I-50. See, I-50. So anytime you have hypertension in the setting of heart failure, it is hypertensive heart disease. You use I-11. So we get rid of A. It's sequencing I-10 first. That's the only HTN code. IB, excuse me, B, and let's just get rid of A and D first, and let's eliminate I-10 because that's for um, hypertension with no other related or causal diseases. And then we have B and C left, and the only difference is the sequencing order, and the guideline tells us the sequence first, I-11, followed by I-50. So we eliminate B, and our answer is C. Okay, so somebody said, hey, I missed. It's okay. Guess what? You learned something. If you learned something, that is priceless, and you will get it over time because you're going to see this over and over. And if I'm a betting girl, you're going to see it on your exam and you're going to be ready. I guarantee it. So, outstanding job, everyone. A lot of people got it. They said, hey, I got it. And they did amazing. Oh, wow. Let's see. I think oh, you know what? Do you all realize we didn't even look in the book? You all solved this scenario without looking in the book. Outstanding. So let's say you do look in the book and you try and code this. I-10 is for primary hypertension. I-11 is hypertension and heart disease, right? So we know primary is not correct, so we eliminate A and D. The hypertensive heart disease, I-11 is the correct category, and we know specifically that I-11.0 is appropriate because this is hypertensive heart disease with heart failure, and look at that instructional note. The instructional note tells you to use an additional code to identify the heart failure. So we know we're not going to sequence I-50 first, we're going to sequence it second. Anytime you see additional code language, that means it goes second. So we are going to eliminate B, and C is our answer. And just to do our due diligence, this is the code for heart failure, I-50.9 when it's not specified. All right. So just to kind of do the due diligence, diabetes type 2 is E11.9. We learned those two ones. And then your GERD, excuse me, let's go back. And your GERD, your gastroesophagitis without, excuse me, gastroesophageal reflux disease without esophagitis, because there's no mention of esophagitis. So therefore, K21.9, and underneath it says esophageal reflux, not otherwise specified as K21.9. There's something else I want to point out. In your ICD-10-CM manuals, you can document this is hypertension with heart disease. This is hypertension with kidney. And this is just hypertension. So if that helps, priceless. All right. Miss Stephanie, please and Thank you.
Thanks for tuning in, and until next time, happy coding!